Are you COVID positive? Watch this video to recover as soon as possible. Even if you had COVID-19, continue watching this video. First of all, you will be needing to monitor your SpO2 levels, your pulse and your temperature. For this, you will be needing an oximeter and a thermometer. You need to monitor these three things every day, thrice a day, and send it to your doctor daily. Your SpO2 levels should be more than 94. If it consistently drops below 94, I suggest you get oxygen supply or a bed in a hospital. Your pulse should be always less than 125. And your temperature must be less than 102 degree Fahrenheit. Now, let's come to medication. Medication is really important when it comes to fight COVID-19. I suggest you take the medicines listed below after consulting your doctor. I suggest you take the Azithral, Montecalci and Pan 40 only if you have a sore throat. Now, let's come to nutrition. It's really important to provide good nutrition when fighting COVID-19. I know you won't feel like eating much, but an undernourished body will never recover from COVID in time. There are 4 really important things you need to have in your diet. Number 1. Protein. Protein will help to repair your damaged cells faster. Some good sources of proteins are lentils, eggs, beans, chicken, chickpeas and soya. Number 2. Anti-inflammatories. See, COVID-19 causes a lot of inflammation in your bodies. So it is really important for you to have some anti-inflammatories in your diet. Some good sources of anti-inflammatories are warm haldi milk at night, ginger garlic paste 3 to 4 times a day, nuts. Number 3. Antioxidants. Antioxidants are stable molecules which help to reduce the damage caused by the free radicals. It also increases our immunity. You can get antioxidants from certain fruits and most of the vegetables. You can eat vegetables like broccoli, spinach, potatoes, kale, cabbage and carrots. Number 4. Water. I suggest you have a lot of water, at least 3 to 4 liters a day. It is really important to stay hydrated when you have COVID-19. I also suggest you have herbal tea with ginger and tulsi leaves. You can use either warm milk or water. I highly suggest you reduce your sugar intake when you are infected with COVID-19, as sugar is one of the top inflammatory foods. Now, let's talk about supplements. Supplementation becomes really important when it comes to fighting COVID-19. I suggest you take the following supplements after consulting your doctor: vitamin B, vitamin C, vitamin D, zinc, ashwagandha and giloy. Now, let's talk about proning or lying down in a prone position. If your oxygen saturation or your SpO2 levels fall below 94 and you don't have oxygen supply, I highly suggest you do proning, which is lying down on your stomach. It will increase your oxygen saturation by 5% naturally. I suggest you avoid proning immediately after meals. And you can prone for up to 16 hours in a day with gaps in between. Now, let's talk about mucormycosis, also known as black fungus. Mucormycosis is an opportunistic fungal infection. If you have diabetes or you are taking steroids for the treatment of COVID-19, you are at a higher risk of developing mucormycosis. Why so? Because in diabetes, your blood sugar levels are constantly high, and this fungal infection feeds on your blood sugar levels. Number 2. Steroids. First of all, I am not talking about the bodybuilding steroids. These steroids are well-known immunosuppressants, and you are at a higher risk of developing mucormycosis when your immune system is down. Never ever take steroids until and unless prescribed by your doctor. What are the symptoms of mucormycosis? Some common symptoms of mucormycosis are foggy or double vision, nose bleeding, numb cheeks, toothache and eye pain. If you have any of these symptoms, kindly tell your doctor immediately about these symptoms. How do I prevent mucormycosis? Number 1. If you are taking steroids, make sure you are having an antibiotic with it. Most probably your doctor will take care of this. Number 2. I highly suggest you use disposable masks. and throw them every day after the use. As mucormycosis usually grows in places where there is moisture, so I don't think you should use the same mask every day. Hence, you should use disposable masks. If you're using an oxygen cylinder or an oxygen concentrator, I highly recommend you change the mask that comes with it. This fungal infection feeds on your blood sugar levels, so it is really important to keep your blood sugar in control. If necessary, consult a diabetologist. Now, let's talk about some important investigations. Your doctor might ask you to take some tests like CT scan, IL-6, D-dimer, CRP, ferritin, LFT and CBC. Only take these tests if your doctor has told you to do so. So now, let's talk about vaccination. Currently, in India, 2 vaccines are available, Covaxin and Covishield. Irrespective of whichever you are taking, you will have to take 2 doses of the vaccine. Both of the vaccines' efficacy is between 68 to 85%. The time duration in between the 2 doses of Covaxin is 4 to 6 weeks and for Covishield it is 8 to 12 weeks. You might experience a little bit nausea, headache, fever and body ache after taking the vaccine. These are completely normal, so don't worry. You will develop antibodies 2 weeks after your second dose, so don't be complacent. Now, let's come to a really important point. Who cannot take the vaccine? There are some kind of people who cannot take the COVID-19 vaccine, and these are pregnant women, breastfeeding mothers, people below the age of 18, people who are generally allergic to vaccines, and people who are undergoing chemotherapy. Rest, everyone with any comorbidity can take the COVID-19 vaccine and should take the COVID-19 vaccine. Now, let's come to a very important question. Do you need the vaccine if you're infected with COVID-19? And the answer is yes. Even if you have COVID-19 or you had COVID-19 previously, you will have to take the vaccine 3 months after you tested negative. And you will require both the doses of the vaccine, according to the latest guidelines. I highly suggest you do steaming thrice a day. Steaming will help to damage the protein coat of the coronavirus. It will also help to prevent the infection from coronavirus. I also suggest you do betadine gargles thrice a day. Now, let's talk about post-COVID care. What should you do after you have recovered from COVID-19? After your symptoms have gone and you've recovered from COVID-19, you can start your daily normal activities. I suggest you wait at least 2 weeks before starting any physical exercises. After 2 weeks, I suggest you do mild exercises like walking, cycling, yoga, resistance training and some breathing exercises like Anulom Vilom. I also suggest you do some pranayams to increase your lung capacity. Notice how your body responds to the exercise. Is it responding well? You can gradually increase the intensity of your exercise when your lung capacity returns to normal. It is really important to change your toiletries and dental tools like your toothbrush, toothpaste and soap after you've recovered from COVID-19, especially if you're sharing your bathroom with someone else. COVID-19 affects different people in different ways, so it is really important for us not to be complacent at this point. If you're infected with COVID-19, it is really important for you to keep yourself busy. I suggest you stay connected with your friends and family over social media platforms and make a lot of video calls. It is really important to get good quality sleep. This too shall pass. Wish you a speedy recovery and thanks for watching.